Government of Jammu and Kashmir are taking lots of efforts to overhaul the healthcare system, and today Confederation of Indian Industry, in collaboration with some of the local stakeholders, organized a day-long health conclave in which different stakeholders deliberated how to go about it and how to rebuild the JNK's healthcare system. You're watching Awaz the Voice, and I'm Nazir Ganai. Uh, we have a very important stakeholder with us from Bajaj Allianz, Mr. Ijaz. Ijaz sahab, a lot of things have been discussed in this conclave, and a lot is to be done as far as the healthcare system of Jammu and Kashmir is concerned. You were a very important agency for Jammu and Kashmir government. Uh, you also suggested that different stakeholders and especially the government should come in and they should give the a premium to the needy people. Do you think that's going to help to overhaul the system?
See, when we're doing the debate, see what अगर आप कहीं भी देखें, you see world over 2-3 schemes run. One is the government runs the whole system. Two is you have a private public partnership, and three is you run in a trust model. So in JNK they started a very good initiative of paying premium for everyone, and they thought that let us keep the cost low and make everybody happy. But then that will not help create, number one, good infrastructure. Because if you want good hospitals, then you need patients to pay the premium. And if you want insurance company to pay the premium, they will do so to an extent of not making losses, if not making any money out of a business. Say any good healthcare scheme in the country or in the world will run on a sustainability basis. Nobody would want to make losses. So if in J&K, see what I suggested was, why is it that government has to pay premium for everyone? That the government pay for those who cannot afford health insurance premium to pay. Like in Gujarat, we have this model, or elsewhere we have this model. And for the rest of the people, let government create a system wherein they can kind of tax people. See, it is simple. Now, why I'm saying so is, in J&K, you see that if somebody falls ill, people go and collect money to support. Maybe you're not able to sustain, you're not able to handle your expenses. Now, what is insurance actually doing essentially is that it collects money from a lot of people and gives to few who have claims. And luckily, say if today all the 22-23 lakh households pay some premium, and only 1 lakh use it or 2 lakh use it in a year, what are you doing? You are actually doing charity by way of paying insurance premium. So government and industry, if they felicitate this model wherein government pays it, I'm again saying, for the people who can't afford it, and the rest is borne by the people who can afford it, and we have a corpus wherein industry can flourish. We will have investments here, people get the quality care. They don't need to go to Delhi and Bombay for a good health care. We have good hospitals. Our friends here from the industry coming who have set up their hospitals, they're also finding it challenging today because government doesn't have so much money to pay. This money has to be collected. You have to have a conceptually, insurance was a pool-based concept.
Yeah, an ecosystem has to be built.
It has to be built, the government and the industry, to make it sustainable. To go back to the earlier concept of ensuring, everyone pooling the money and using it for few. Obviously, then you have to use kind of technology, blockchain, to kind of do away with the frauds, so that the inflation that happens because of the frauds, or the higher cost claims because of the frauds, is reduced. Then it becomes kind of sustainable for everyone involved.
That was from the insurance point of view, and how the local stakeholders, in fact the industry people, can chip in and they can also contribute. Could you please introduce yourself and how you run your facilities here in Kashmir?
My name is Prabal Ghoshal. I'm the chairman of Ujala Signas Group of Hospitals. So basically, the kind of hospitals services that we provide is all affordable, high quality healthcare to the everybody who needs healthcare to be facilitated. And therefore, we provide all sections in a similar manner that we talked about, the inclusive healthcare model that we run. We don't differentiate between the rich or the poor. In Jammu and Kashmir in particular, when before 2000, actually we started with the poor section to get the Ayushman Bharat scheme. Thereafter, after 2020, which everybody started getting, and everybody has got Ayushman Bharat. So that takes care of the lowest, the poor section of the people. But at the same time, the rich and the middle missing that we spoke about, it's important that private sector health insurance also gets penetrated more into the tier 1, tier 2, tier 3, because the kind of provide services that we provide, it is about 30 to 40% less cost than the tier 1 or the major hospitals in metros can provide. So the surgery cost which we provide at our hospitals is about 30% lower than the hospitals that the similar facilities provided at the metros. So the more and more the insurance companies will find it lucrative to service those hospitals who has the network of hospitals, including metros, including in tier 1, tier 2 and tier 3 cities, where we have the providing the network of hospitals and we provide at a low cost. So therefore the accessibility of these, that's portion of the population would be much more and much more penetrated.
So Ujala Cygnus is doing a wonderful job as far as this sector is concerned, and at the same time, you may also need to reach out to the marginalized people. You also need to do your kind of CSR. That's what was discussed.
We do reach out to actually the remotest of the remote, but it is not that in an organized manner. But we do, as Dr. Bajaj mentioned in his discussion, that we do SEHAT Chopal, which is basically the outreach program, which is a community reach program. It's an awareness program, prevention model that we do comprehensively, and to make them the community belief that how they should maintain their health, how they should take care of their health. So the prevention part is very important for healthcare insurance, because if the prevention part is not blocked at this level, and if people don't take care of their health, then the ultimate, when they get hospitalized, the cost becomes so much that they start selling their land or properties, etc. So the important aspect of the healthcare insurance is comprehensive, which has to be inclusive of prevention, diagnostic, as well as the hospitalization claim.
Dr. Bajaj, human resources were the important key factors for running the facilities. Do you find it difficult in Kashmir?
No, on the contrary, I think Kashmir is home to the most qualified and most competent doctors and nurses in the entire world. And there are many Kashmiris who live outside who dream of coming back to Kashmir and serve their community that they've lived and grown up with. And we have been very lucky at our Ujala Cygnus Kashmir Super Speciality Hospital that we managed to attract doctors from all over the world. Some doctors have joined us back from Australia, some have joined back from the European nations. So we have been just lucky that Kashmiris have a longing for their community. They love to live here. The state is now progressing a lot. So I think it's a very good opportunity for every doctor to come and serve and make sure that they make a big impact in the communities that they've
How important is this single window system? And at the same time, when you work with the government, there are lots of loopholes, there are lots of hassles. Government works in their own kind of what you call is mandate. So lots of challenges are there, and Kashmir is a place where private sector is not that vibrant. Do you face challenges on that part?
See, whenever we need to work with the government, there will always be a slight dichotomy that the government officials will want more and more control on policies, procedures, on what you are trying to do. Whereas the private players will want more and more freedom to do, what they feel fit, what they feel is most efficient, what changes they can bring in processes that can actually drive efficiencies a lot, which the government, due to its inherent large structure, it finds it difficult to do. So there will always be some issues, but I think the government has its heart in the right place. As we've discussed many times, the Ayushman Bharat scheme has been a great differentiator for preventing people from falling below the poverty line due to healthcare shocks. And the government really wants to drive the agenda of healthcare as an industry to rival tourism as an industry in Kashmir. There are minor problems and some speed humps will always be there, but we'll have to work together to drive over them. Smoothly. Yeah.
The government has its heart in place, and that's how it's going to address the challenge in the healthcare system. We have with us Dr. Majid Wani, who was part of the government. He quit the job, started his own facility, and Dr. Majid, how are you doing as a private player now?
Yeah, I'm fine. You nicely said that I was a consultant medicine in Medical College Srinagar. I was a consultant outside, as my colleague told just now, that the people want to leave the green pastures. Who have seen the world, who have worked 10 years in Mecca, in Bahrain, England, visited different European countries, but finally I came to conclusion that serving your own people gives you happiness, because everybody was telling here that happiness, mental health, and where do you get it? Whom do you serve? Second thing, so this made me, when I left the government job, to decentralize the tertiary care. I was pained seeing the deaths on the way, being referred either from Kazigund, from Kopara, from Tangdar, from Kolgam, or from the Pir Panchal areas to the centralized hospitals. On the way, no proper referral center, not accompanying the healthcare worker, forest station on the way. When we used to receive them in the emergency department, luckily I was heading that also in the SMS hospital, Shield Care Hospital. We were just declaring them dead. A driver was accompanying them. So this pain motivated me to do something to decentralize this tertiary care and take back it to the peripheral area. That means Kopara is an aspiration district. I belong to that area. I thought, why not there? So whatever earnings, the government loans, etc. I took, I was successful in establishing an NABH accredited 50-bed hospital in Kopara, there's between Handwara and Kopara, where NABH accredited, where SEHAT empaneled, where Ayushman Bharat empaneled. Yes, we are giving the state-of-art facilities at a lower cost. So I cannot compare with the city-based hospitals. We have the same expenditure, rather more. The delivery of the goods, the equipment, the service, the electricity, which is costly for us, but still we are providing at a cheaper rate. If it costs 1 lakh in Srinagar, to 4 lakh in Delhi, in my hospital, NABH accredited, with good policies, with good, excellent. I have 3 modular operation theaters in North Kashmir. That's one of the best. So on 20 and 25,000 only. So this is what I told made me to move from decentralized the tertiary care. We see the Sikkimers, how much rush is there, how much manpower, the quality of care. We were talking the quality of care. Quality of care depends upon the human resource also. How much manpower you have. So if you have 10 patients or you have 1 doctor or 1 staff, what justice you will do. And that also to the referred patients. That's why the mortality in such stations is very high. So need of the hour is to develop the peripheral health system.
So need of the hour is to develop the peripheral system, and that's what Dr. Majid Wani has done in recent years. He quit government job, started his own hospital, and there are many doctors like him who want to come back from green pastures and do and serve their own people.